So welcome everybody. My name's Katie Wysocki. I'm the Assistant Director in the Career Enrichment Network. We have tonight for our career conversation with alumni. We're focusing on mental health. Rebecca has been kind enough to join us tonight and we'll be sharing her own career journey as well as some advice within the field. And then you are welcome to ask questions either through the chat, through the Q&A box, or again, if you'd like to raise your hand and I can unmute you. Just a little bit about Rebecca. She received her Bachelor of Arts degree in psychology in 2006 from Penn State and is now a licensed clinical social worker. She graduated in 2015 with her MSW from Our Lady of the Lake University in San Antonio, Texas. She currently works at Innova Fairfax Hospital in Virginia, where she has been for the past 2.5 years. She started as a case manager social worker in the neonatal intensive care unit and recently transitioned to her new position within the hospital as a clinical therapist with the palliative care team serving both children and adults. In the evenings, Rebecca serves as an individual therapist with professional psychiatric services in Alexandria, Virginia, where she provides counseling to individuals who are suffering from depression and anxiety. Her employment history includes extensive work in behavioral health in the hospital setting, foster care, and child protective services in the District of Columbia. Employment experiences prior to pursuing her master's degree included working as a psychiatric rehabilitation counselor, working with adults with mental illness, and then at Children's National Medical Center in Washington, D.C., where she served as a child psychiatric specialist on the inpatient child psychiatric unit. Upon completion of her social work degree, Rebecca spent the next 3.5 years working within the Washington, D.C. foster care system, first as a foster care social worker and then as the Director of Health Services. She then spent time working within the Child Protective Services Division under the D.C. government. She continued her work at Children's National, but as a social worker in the emergency department, performing psychiatric evaluations on children to determine inpatient psych placement needs. Rebecca currently resides in Gaithersburg, Maryland, with her favorite four-legged friend, her dog Sadie. In her spare time, she enjoys reading, traveling, and of course, watching Penn State football. So we all look forward to that being a little normal next year too.
Hopefully.
Rebecca, go ahead. We can't wait to hear about your career and great advice.
Okay. Well, thank you guys so much for having me. I'm very excited to be here and to be with everybody this evening. So I did create a little PowerPoint presentation that we're going to kind of go through here. So I am Rebecca Rebstock. I'm a licensed clinical social worker in the state of Maryland and Virginia. I graduated in 2006 with my bachelor's degree in psychology, and I will spend a little bit of time talking about my career path in the mental health field, as well as talking a little bit more extensively about other careers in mental health field other than social work. Uh-oh, it's not working. Let's see. Okay, there we go. So I just did a little agenda to kind of set up how I have my PowerPoint presentation organized. So I'll start a little bit by talking a little bit about myself and kind of where I am currently in my career. And then I'll spend a little bit of time talking about my career path in getting to where I am today. I'll spend a little bit of time talking about careers in mental health at the bachelor's degree level, as well as the graduate degree level and beyond, such as social workers, licensed counselors, psychologists, and other mental health multidisciplinary team members. And then, as Katie mentioned at the end, we'll have time for questions and comments, and hopefully I can answer any questions that you guys might have. Anytime that I come back and do alumni events, I really like to emphasize that when I graduated from Penn State in 2006, I did have not a clue as to what I wanted to do career-wise. I didn't have a job lined up. I just kind of wanted to get through graduation and then I was going to figure it out as I went. So I always like to emphasize that it is okay if you don't yet know what you want to do professionally. You'll figure it out. You'll learn things as you go. You'll meet people who will influence you. So I don't want anybody to feel a level of stress by not knowing exactly what their career path is right now. So a little about myself, and I can minimize this. So a little bit about myself. I got my Bachelor of Arts degree in psychology, and I did minor in human development and family studies at Penn State. I went back in 2015 and got my Master of Social Work degree at Our Lady of the Lake University in 2015. You will notice there's a large gap between my undergrad and my graduate school. And that was because I was really trying to figure out what route I wanted to take long term. Did I want to be in the mental health field? Did I want to be a social worker? I thought about nursing for a while. So there was a large gap between undergrad and graduate school. And for graduate school, I did an online program. I was working full time at Children's National Hospital is what it's called now, and I was working full time there while attending graduate school full time, and I'll talk a little bit about that coming up. I am currently a licensed clinical social worker. And as Katie mentioned, I'm working as a palliative care clinical therapist at Nova Fairfax Hospital in Virginia. And in the evenings, I work part-time as a therapist with adults who are suffering from depression and anxiety. A lot of people may not know what palliative care is. It was a foreign concept to me before I started at Inova. But it stems from the word to palliate, which means to relieve or lessen without curing. And specifically, with a comprehensive care team that is focused on social workers or composed of social workers, nurse practitioners, doctors, and a chaplain. So we kind of look at all aspects of a patient pain and their medical diagnosis, knowing that we're not going to cure it, but we're trying to control it in terms of symptom management. The psychosocial emotional support, which is what my job is, and kind of going and being able to talk to patients and provide that emotional support while they're hospitalized. And the spiritual aspect of things, by which is supported by our chaplain, who goes to visit our patients and provide that spiritual support. That's a little bit about where I am currently in my career. So I did a little kind of career path and how I got to where I am today. When I first graduated from Penn State, about a month after I graduated, I, of course, only had my bachelor's degree at the time. But I got a job at a small nonprofit organization who was working with adults with severe mental illness. And throughout my time at Penn State, didn't really find the abnormal psych class is super interesting. I always thought I'm never going to work with people with mental illness, but I have come to find out during my career that every job and every kind of career journey I've taken has had a mental health component to it in each position that I have held, whether it's with the patients, whether it's with family members, whether it's working directly with people who are diagnosed with severe mental illness. So I was working with adults from 2006 to 2008. And during that time, we were in a day program setting where they would come to the day program and we would provide kind of therapeutic groups, life skills, teaching them about their mental illness. And at that level, you only needed a bachelor's degree. So I did that for almost exactly 2 years. And then I kind of got this interest in the hospital setting and really wanted to kind of see what hospital life is like. So I got a job in 2008 as a child psychiatric specialist at Children's National Medical Center or Children's National Hospital in Washington, D.C. And once again, there, I only needed a bachelor's degree. And I was working on the inpatient child psychiatric unit at Children's. It was a unit of 12 beds serving ages 3 up until 13. And these were patients that were experiencing acute psychiatric needs, whether it was depression and they were feeling suicidal, whether it was severe anger issues, a lot of behavioral issues, autism, eating disorders. We really saw a wide array of diagnoses during my time there. And it was during my time at Children's National that I really started to feel like I wanted to do something more with my career, and I wanted to advance my career. And I saw and met so many amazing people that really challenged me and encouraged me to pursue a further degree. And I decided upon becoming a social worker. So I went through school. I did the program in about 2.5 years online. So started in 2013 in January and graduated in May of 2015. So upon graduation from 2015 to 2018, I worked in the child welfare foster care system, all in the District of Columbia. And at that level, I just had a master's degree. I was licensed at the graduate level, which I'll talk a little bit about in my future slides. Um, but I was working on reunification, so reunifying those children who had been removed for abuse or neglect back with their biological families. And then for the last year, I worked in the Child Protective Services Division. So that was actually going out and investigating, alleged abuse or neglect of young children in the District of Columbia. And a lot of times we would partner with the police department in DC, a lot of school partnering, because a lot of times teachers would be the ones that would have these suspicions of abuse or neglect. It was extremely, extremely challenging to be a CPS or child protective services worker, but I learned a ton about myself, and it was a very valuable experience that I'll definitely carry with me. In my time doing foster care, I then figured out the hospital setting was a little bit more where I was comfortable with, where my heart was at, in dealing with sick patients. So I applied. I got a job as a case manager, social worker in the neonatal intensive care unit at Inova, and there I was doing a lot of emotional support. The neonatal intensive care unit is very tiny babies who were born most of the time very prematurely or have some extreme medical condition, and just providing a lot of emotional support to the families. I loved it there. But I became a licensed clinical social worker and wanted to try to continue to challenge myself professionally and join the palliative care team. And that's where I've been since January. I absolutely love it. I have an amazing team that I work with. I work with amazing patients of varying ages. I do support the pediatric population is my specialty, but I do serve the adult population as well. So I want to spend a little time talking about just careers in mental health at the bachelor's degree level, because I think that a lot of times there's a little bit of a misconception that you need an advanced degree to get any type of job in the mental health field. And I feel like I kind of felt that way too when I was first graduating from PSU. But I did find and have found throughout my career that there are jobs that are available and that are out there at just the bachelor's degree level. So a lot of smaller community-based nonprofit organizations or county or state government agencies will have job opportunities available that only require a bachelor's degree. So this could be a rehabilitation specialist, which is what I was doing at a community-based nonprofit organization when I first graduated, or social work assistants. A lot of times county or state governments are looking for a social work assistant, which can really introduce you into the social work field. In addition, the hospital settings, a lot of times you can get a job as a technician or a mental health technician, which is basically what I was doing as a child psych specialist when I was at Children's National, or a psychiatric technician is basically what we were called, but that did require a bachelor's degree, but nothing beyond that. And then the other setting would be the educational setting. And that's where a lot of times people can get jobs in working with those with special needs. So this could be a ABA therapist, which I'll talk a little bit about, or student or a teacher's aide of some kind that can just kind of introduce you to the pediatric population if you think you're interested in working with children. The next slide here is careers in mental health at the graduate level and beyond. I'm going to talk mostly about the social work career path, the licensed counselor path, and then a doctorate degree of psychology as another pathway. And then at the end, just kind of talk a little bit about multidisciplinary mental health team members in general, so that you can kind of get a sense of who composes those that make up supporting those with mental illness. So first, we'll talk about the social work career because that's obviously what I am passionate about. That's where my heart is, and that's obviously the career path and journey that I chose to take. And when people ask me, how did you decide to become a social worker, or why did you decide to become a social worker? I always say it's because I wanted to help people. I often felt like my friends were coming and confiding me and telling me, their their feelings and emotions a lot of the time. And I felt like I could do that, professionally in a long-term setting. So social work is defined in Webster's dictionary as services or activities designed to improve social among the poor, the sick, or troubled persons. And this really encompasses a lot of what I have done in all of my jobs and in all of my career paths. Social work has such a broad array of specialties. And you think about, do you want to go the micro route, the meso route, or the macro route? Do you want to work with one individualized person? Do you want to work with a family? Do you want to work in the community? Do you want to work to change social issue policies? So those are some things to think about as you're going into the social work career, if that's the path that you choose to take. But also knowing that social work, there's so many opportunities. You don't have to stick in one particular pathway. Some of the specialties include working with the geriatric population, so working with those that are older or elderly in a nursing home setting. Psychiatric social workers working like on an inpatient child psych unit or an inpatient adolescent unit. Child and family services, so this would be foster care, child protective services, hospice and palliative care, which is what I'm currently doing, medical and health social workers, and then there's mental health social workers, substance abuse, school, military veterans, just a wide variety. And with a master's degree in social work, you can really pursue any of these specialties along the way. And I just put lots of career paths to take in this field, but they all have a mental health component to them, which is what I mentioned earlier. So in everything, working from child protective services all the way through to the hospital setting, you will always find mental health as a component in some way, shape, or form. I would say with the majority of even the patients that I see now. I wanted to break it up a little bit as to the levels of licensure for social workers, and this can vary from state to state in terms of what the licensure is actually called. But I kept it as general as I could and kind of tried to stick with those licensures that are pretty standard, at least in this area of DC, Maryland, and Virginia. So you have a licensed graduate master's social worker. So it's either called a licensed graduate social worker or a licensed master's of social work. This is called an LGSW. You have to pass an exam to be licensed at this level. You only have to take one exam, and then you can get that licensure to go into other states if you decide to move. So it is only one exam. And this was the level of exam. I did spend a period of time working in the emergency department at Children's National, doing psychiatric evaluations to determine acute inpatient psych needs. And I was able to perform this job with my LGSW. And then the licensed clinical social worker, you have to take another exam at this level after receiving some supervision hours at the LGSW level. This does require that second exam. And an example of what you could do professionally with an LCSW would be conducting therapy or one-on-one counseling. And that is something that I do in the evening time. So for that particular job, I did have to be a licensed clinical social worker. So that's just a little bit about the social work profession. And now we will move on to Careers in mental health for a counselor. So counselor or licensed practicing counselor is defined as an advisor, to give advice, or to recommend. This master's degree can be called different things, once again, based on the school that you attend. So it could be called a Master's of Mental Health Counseling degree or a Master's of Community Mental Health Counseling degree. This path, if you choose to get a master's in counseling, this path is geared more towards knowing that you want a career in counseling or therapy. So whereas in the social work career, you kind of have different routes and different avenues that you can take and different levels that you can kind of practice at. With a master's degree in counseling, it's definitely more focused towards knowing I want to be a counselor. I want to have that therapeutic role. I want to, work in a private practice and 8 hours a day, I'm having those one-on-one sessions with clients. If you know that that's what you want to do, and that's what you want to do for the rest of your career, definitely going this route with a master's degree would be a little bit better as opposed to the social work degree. There are varying levels of licensure for this profession as well. So you have the LGPC versus the LCPC. And this can also vary by state to state as well. So you have a licensed graduate professional counselor degree or licensure, and this is done by exam. So when you graduate from your master's degree program, you're required to pass a law exam as well as the national counseling exam. So this is just one exam that you have to pass, and then you're licensed as an LGPC. During your time as an LGPC, you would then likely get supervision hours under an LCPC or licensed clinical professional counselor. And once you get a certain number of those supervision hours, that usually takes about 2 years or so, you can then apply to get a licensed clinical professional counselor licensure. And with that, does not require a second exam, which is great because for the social work, you have to take 2 exams at the different licensing levels. This one, you only have to take 1. So that's nice too. And then kind of the last career path I wanted to talk about is becoming a psychologist. So clinical and counseling psychologists must obtain a doctorate degree in psychology. The focus of this degree is usually going to be on therapy and assessment, and not so much on theory or research or consultation work. So once again, if you go this route with the clinical and counseling psychologist, you're thinking more that you're going to want to do therapy. You're going to want to do those more in-depth assessments, really getting to the root of mental health issues, what's really going on with the person, usually on an individual basis. Therapy and assessments are defined as psychological evaluations that can reveal important information about a person's mental illness, personality, functioning, abilities, safety, risk. So these are just some of the things that would encompass those therapy and assessments that you would be doing. And you might ask, where would I be doing these therapies or assessments if I became a psychologist and I wanted to go the clinical and counseling route as a psychologist? So there are once again, a lot of different settings that you can practice in: the hospital setting, outpatient, college counseling, schools, jails, prisons, courts, primary care. So many different organizations definitely need psychologists and need somebody to kind of perform those thorough assessments on individuals. And so these are just some of the settings in which those assessments can be completed in. Usually this program takes about a five years. So as opposed to the counseling master's or the social work master's degree that takes anywhere from 2 to 3 years if you're going full-time, maybe 3.5 if you're going part-time. This career path would then take usually a minimum of about 5 years of schooling. once you've completed the degree and you've graduated, there is a licensing requirement in most states. It's called the examination for the professional practice in psychology. Does require 70% or higher to pass the exam. So once again, one test that you have to take. So a little bit longer schooling, the one exam that you have to take, and that's more for the therapeutic assessment route. There are some other degrees that psychologists pursue if you don't want to go the assessment therapy route. And some of these other degrees may be the PsyD, which is the clinical work focus, a PhD, which is more focused on research, if that's something that's of interest to you, or an education doctorate that's focused on education and schooling. And I just want to kind of include, I know I had mentioned earlier that a bunch of the fields of mental health have so many multidisciplinary team members that encompass, who's providing help to patients, clients, whoever it might be. So some of those other mental health multidisciplinary team members would include registered nurses, psychiatric mental health nurse practitioners, psychiatrists, so those that are prescribing the medications to manage the person's mental illness, applied behavioral analyst therapists, so ABA therapists, and mostly they're working with those with autism, and psychiatric technicians. You may come across those as well. So this is kind of a general overview of some of the other career paths that people take, but are still have a mental health component, or still wanting to help those with mental illness. And if you became a registered nurse, I know I considered nursing for a while as well. There are special exams that you can take after you become a nurse to be certified in the mental health field. So I think that's basically it for my presentation. I definitely wanted to I know I went through that kind of fast. Definitely wanted to have plenty of time at the end to be able to answer any questions that you guys have. I really, once again, just want to emphasize it's okay to not yet know what your career path is, to have questions about it, to take some time after graduation to figure out what exactly you want to do. That is okay. You will figure it out, whether it takes a month, a year, or what was it, 9 years for me before I got my master's degree after graduating undergrad. You will figure it out. You will do it in the amount of time that you are comfortable with. So thank you guys for allowing me to spend this evening with you, and for allowing me to have this presentation and giving this presentation to you guys. Please feel free to ask any questions, comments. There are no silly questions. And I put my contact information on here. So if you have any questions after tonight or after today's presentation, please feel free to email me directly. If I don't have the answer to the question, I will definitely utilize resources to try to get you the answers. So thank you so much.
Thank you, Rebecca. Wonderful presentation. I really appreciate you bringing up what a psychology major can do with a bachelor's degree, because we have that conversation often. And I myself was a psych major, so you never know the path you're going to go. So we have 2 questions right now in the Q&A. So the first one is, hi, I was wondering what the major difference would be between clinical psychologist or a licensed clinical social worker. Thank you.
Yes, thank you so much, Willa, for your question. So that it's definitely, oh, did it go away?
Oh, sorry, that was me.
It's okay. So I think that with clinical psychologists, it's just a little bit more intensive. It's a little bit more involved, I guess, and you can do a lot more than what you could do as just a licensed clinical social worker. So it's, psychologists often just, I think, have more opportunities in the medical type of field of things, rather than social workers that are just kind of just doing that individualized counseling, and not so much the medical doctor side of things. And I think a lot of times, like those, say, for example, a psychologist can is doing an assessment maybe on somebody who's incarcerated, and that information might have to go to court and be presented in court by a psychologist, and can hold just, I think, a little bit more um, groundwork than what a social worker might be able to present.
We have two questions in the Q&A box, but I also have a hand raised. So I'm going to ask the first question in the box, and then we'll get to you, Taja. The question is, are there other career paths that you know of that one could do with a psychology MBA?
Mm-hmm.
I,
Yes.
I was going to say there's a great resource on Penn State Student Affairs Career Services website. It's called "What Can I Do with a Major In?" And I was actually just on it with a student this morning, and it breaks down industry per major. So, psychology, business, HR, obviously health services, and quite a lot in between. So go ahead, Rebecca.
Yeah, definitely. I would say exactly the same thing. So I've met so many people along my personal life and in my career journey that have said, oh, I have my bachelor's degree in psychology, and they're doing something totally different than like the one-on-one counseling or the therapeutic interventions or the assessment type of stuff. So I think psychology just provides you with such a good foundation for a broad array of things to move forward with. And like Katie was saying, like you could do human resources stuff. You could do, it doesn't just have to be that therapeutic intervention. So there are definitely different routes to take in different industries for sure.
Okay, let's see here. I'm going to allow you to talk, Raja, if you want to go ahead.
Hi, my name is Tasia.
Tasia, I'm sorry, I mispronounced that, Tasia.
It's okay. I get that all the time.
I'm sure.
It's okay. I'm a sophomore, and I've been looking for different ways of gaining experiences within the psychology field. So I talked to professors, students who were graduates. I already have an idea of what I want to do. I know that I want to work as a clinical child psychologist or therapist in an individual counseling session. If necessary, work with their parents and other family members that's influencing their lives to support them emotionally and mentally. So with that being said, my question is, what is your recommendation for researching for different internships and experiences as a starter while you're an undergrad student?
Yeah, I mean, I always tell students that I've worked with in the past, any kind of intern experience that you can get, I feel like will be beneficial to you no matter what career journey you take. So don't feel like you have to be focused on getting something that is in the psychology field or in the social work field or something that can will further your career in the clinical setting, no matter what path you choose to take. Any type of intern experience will be helpful for you. I had an internship, I think it was between my junior and my senior year. I was linked to a mentor when I was a student, and she was able to get me an internship, and it was nothing related to psychology, nothing related to counseling. It was at the University of Maryland. It was a part of a leadership program, and I was just interning, doing a lot of like desk work, like the boring stuff, copying papers and, running errands for them and calling different people and stuff like that. But any work experience that you can get while you're still a student will be beneficial to you no matter what career path you take. So definitely don't feel like you have to really focus in on the clinical therapeutic side of things at this point, because those internships, no matter what you do, will boost up your resume and make you very marketable as you move forward.
And unfortunately, there's just some barriers, right, between our students and internships and the clinical side of things with HIPAA that, and that perfect experience that's going to mirror what you'll be doing in the future doesn't necessarily exist. But, Rebecca's absolutely, that's exactly what I tell students. And even if Tasia, that you want to work with kiddos, then work at a summer camp or, find
A
ways to work.
daycare.
Exactly.
Yeah. Mm-hmm.
Populate, or like you had mentioned with like a residential facility, that is looking for support, that you will really empower your resume. So great question. Thank you so much for raising your hand. We have one more in the chat, and then we'll switch back to Natalie, who has her hand raised. Have you found that there's a big difference in the careers of people who graduated with a BA versus a BS?
So I will say most of the people that I know have done BAs in psychology. So I can't really speak to the BS side of things. I don't know, Katie, if you have any more information on whether it really makes a difference or not. I wouldn't think so too much. I mean, a lot of times companies, organizations, schools are just asking like what your degree is in, but I don't think it would really make a difference as to whether you have the BA or the BS.
I think it's just, your arsenal, your tools that you're bringing with, obviously at Penn State with the BA, you're taking some type of language, that could be helpful. Maybe in the BS, you're doing more research or more work with the SPSS or other statistical software, or, the actual research that could be more of the, the PhD clinical type, route. I really see diverse and similar paths for both. So definitely, for sure. Yeah. Any other questions? Nicole, I saw your hand went down, so I'm guessing maybe we answered your question. In the meantime, Rebecca, everything you do is so amazing, and your support for people and all the different jobs you've had. What has been your philosophy in remaining focused on your own self, mental awareness, and how you're taking care of yourself through all of these? I think of the neonatal, and I, it must be hard from day to day and what you're doing now. So how are you examining your own mental health through all of that?
Yeah, it's definitely challenging. And I have a mom who literally asks me every time that I see her, "Are you okay? I feel like your work is really hard. I feel like this is really difficult work. Are you okay? Are you taking care of yourself?" So having that check-in is always helpful too. But one thing is I really leave work at work. I try to get everything done. Like, do I have access to all my patients from home? Yes, I do. Can I log in and do work from home? Yes, I can. But I definitely try to do all my work during the day, utilize those 8.5 hours to get everything done. Even if it means I have to like work through lunch, or, maybe not even eat lunch that day, just to get everything done in that 8 hours. And then once I leave work, I leave it there. Like, yes, do I have people that I can talk to and process through, my friends, my family? Absolutely. But definitely trying to leave everything there, know that it will be there tomorrow for you, or, maybe you have patients that pass away. Those are hard, and you process through with your coworkers too, and your colleagues. They can be your greatest resource and supports, because they understand and they know what you're going through. Especially in this new position, it is challenging. A lot of our patients do pass away. And then we have a lot of great moments too. Those patients that you can really make an impact on, and see that you've made an impact on, or they voice that to you, and then all that, then it makes everything rewarding and worthwhile for sure.
Yeah. Anyone else have a question? Because I can always ask more. Are you taking advantage, Rebecca, of the Penn State network at all throughout your career, or in DC, in the Virginia area? You find networking to be a part of your career as well?
Yeah, definitely. Networking is so big. I would say every job that I've had, with maybe the exception of my initial move to Inova, but even then I knew somebody. But every job that I've had, I've known somebody at the company that I'm going to work for, that I'm trying to apply for, whether it's I've worked with them previously, or, once you get into an organization, then I find like you network within that organization. And Nova Fairfax is a huge hospital. It's actually 3 hospitals in one: the Women and Children's Hospital, the adult, and then Heart and Vascular. So it's a huge organization. It's all about who you know. So this current position that I'm in right now, the former therapist, I knew her really well. She told me she was leaving to go to another social work position within Inova. And she connected me with her manager, and I interviewed, and I got the job. So it's definitely, networking is so important. I know Penn State has a bunch of alumni events too. I tried pre-COVID, definitely tried to go to as many of those as I can. And I've really um, said to myself from the day that I graduated from Penn State that I really wanted to remain involved. I really wanted to keep that connection with current students, with alumni, doing events as much as I could, because that will definitely help you too. Penn State's a huge university, so many people, a lot of people with Penn State pride that want to help current students. So networking is very important, and definitely key in the workforce.
Thank you for that. I say that often, but I'm like mom sometimes, so I appreciate it.
No, it's
Yeah,
true.
it is very true. I wish I graduated from Penn State. The association is just amazing, and the support.
Mhm.
So, one more question. How did you realize you wanted to work more in the hospital setting? And also, do you feel like you were well prepared going into your careers, or do you feel like it came with experience, exposure as well?
Mhm. It's a really
The
great
question.
question, Willa,
Yeah.
and two-part question, and definitely making me think too.
And I won't move it to answered, so it stays
Okay.
there for you to
Yeah, I
see.
gotta like refocus on it. We'll start with the first part. How did you realize you wanted to work more in a hospital setting? So it's funny, when I was growing up, I always hated hospitals. My grandma got sick. I didn't like hospitals. She passed away of cancer. I was like, hospitals are creepy. I don't like this. Um, but I think I realized that a lot of times when people are in the hospital, those are sometimes the most vulnerable that need the most help. They're very isolated. It's a very sad kind of situation that they have to be in. Nobody wants to be in the hospital, even though it can lead us to being cured of things or help to make us feel better. Nobody wants to be in the hospital. I also liked having a job that was more like centered. I could drive to work every day. I'm in that hospital all day long. I'm not driving around the community. So that's something else to think about. When I was doing foster care and child protective services, I was driving all over DC and Maryland, because all the DC and Maryland have reciprocity with each other. So a lot of our DC kids who were in the foster care system were actually in foster homes in Maryland, because there aren't enough in DC. So I was driving all over, sometimes hour and a half away up to Baltimore. Didn't really like that. So I like having one core setting. And in the hospital setting, you get to know like so many multidisciplinary team members and so many people that have been in the hospital for so long working there, that you really get to build a relationship and a rapport with doctors, with nurses, patients. Sometimes you'll see them discharge and then you'll see them come back again. So I just kind of went out on a limb, was like, let me try this, fell in love with it, tried foster care for a while, realized I don't like this, went back to the hospital setting, and I can really see myself being at Inova Fairfax for the foreseeable future for sure. And there's just a lot of opportunities in hospitals as well. You don't have to stay in the one position. You can definitely move around once you're in the system. And then the second part to your question, do you feel like you were well prepared going into your careers, or do you feel like it came with experience or exposure as well? Great question. I feel like Penn State did provide me with a wonderful foundation for my career moving forward. Didn't know what that was going to be, but I have now looked back on it and realized that, my coursework there, the organizations I was involved in, my minor in human development and family studies, all provide me with a great foundation. But I will say, when it comes to the licensure level and having to take those exams, the thing I found most helpful over studying and reading books and watching YouTube stuff, like YouTube videos on how to study and everything, was really the experience that I had. A lot of the questions for the social work exams for both of them were focused on mental health questions, mental health diagnoses, what constitutes abuse or neglect, medications for psychiatric disorders. So really all of my career, all the way from when I first graduated, not just at the master's level, but when I first graduated all the way through till now, has really provided me with the experience and the exposure to really advance my career. And I think really helped me with passing both my licensure exams. They're very difficult. I am not a good test taker. I was never a good test taker. And I passed both exams, on the first try. And so that I really think was a reflection of the exposure and the experience that I had throughout my different jobs. That's a really great question. Thank you.
Definitely a great question. Thank you, Willa. I'll give it a second if anyone else has a question, but this has been so helpful, Rebecca. Thank you so much. I'm so grateful for your time and the ability to record. So if anybody would like to refer to anything at a later point, it will be up on the College of the Liberal Arts YouTube channel on the Career Enrichment Network playlist. And as will all the other events we've had this year are there as well. So we've had a couple other areas focused in psychology type careers as well to check that out. All right. Well, thank you all for coming. And Rebecca, again, great to meet you. I look forward to working with you more again in the future. Maybe having you on campus again at some point in time. Hopefully. So everyone have a great night, and you are always welcome to reach out to anyone in the Career Enrichment Network to schedule a one-on-one career coaching appointment. You can do that through Nittany Lion Careers or email me directly at kmw30@psu.edu, and we can work something out and get you into the system and scheduled for that career appointment. We will be doing it all summer long. So even if the semester is catching up to you and you only have 2 more weeks left, we can always meet in the summer as well to talk about the fall and what that might look like. So thank you all for being here. Rebecca, thanks again. We really appreciate it. So we'll see you all soon.
Take care. Have a good night.